us break down the fine print and give us the initial reactions, we have Dr. Sumesh Kumar, economist and associate professor at International Institute of Health Management Research, joining us now. Dr. Sumesh Kumar, what do you make of the announcements made? We did see some announcements in creating AIMS, Ayush AIMS, some announcements for mental health. But can you read through the fine print and tell us what has been the emphasis in the healthcare region, especially for biopharmaceuticals? An allocation of 10,000 crores is very, very encouraging. So how do you see the announcements of the budget for your sector and overall?
Yes, thank you so much. And I think for health sector, this is a good budget, particularly pharma sector. We are already, pharma hub, and we are providing medicines to the rest of the world. And this will give more boost to the pharma sector in the country. And particularly, I am very happy that now government is thinking about the mental health as well. And the new institutions will be set up, which is very good. And mental health issues are increasing day by day. So serious steps need to be taken, and this is something very good that government is thinking in that direction. One more thing, and that is setting up 3 new medical institutions as well as the Ayurvedic medicines are concerned. Then boost to Ayush. This is something again welcoming step by the finance minister. And again one more thing, increasing the capacity of district hospitals, which is again very good because the public health system somewhere the infrastructure need to be developed. The accessibility and affordability of drugs is very high, and day by day it is increasing. And now the cancer medicines and this critical
basic customs duty for cancer, drugs for cancer care, and 7 rare diseases. But the basic duty exemption is only for it being imported for personal use, not on a hospital or a pharmacy basis. What about the announcements coming in for medical tourism hubs? India is in any case doing very well. What do you think is the government's idea behind developing these hubs when the private sector is already, it's lucrative for them, so they do it. What outcome can we expect from these medical tourism hubs?
Yes, actually there is a lot of potential in this sector. Though we are doing very good in that, but still the potential is there in medical tourism. We have best doctors, best corporate hospitals, and even the treatment cost in India is very less. So I think again welcoming step by the finance minister to develop these centers. One more thing that clinical trials, 1,000 new centers will be developed. So research and development in health sector, again this is very good. And overall I think I would definitely like to see that overall expenditure as a percentage of GDP on health. So we are struggling with that from last I think more than a decade. So the need of affordability and accessibility of healthcare, which is very important. And yes, research and development and clinical trials, again one good step.
Dr. Sumesh Kumar, I asked you a few questions. One, the provisions of the budget for the healthcare sector. To your mind, has the budget done enough when it comes to our social infrastructure? The physical infrastructure capex has grown. We don't have the numbers for the social infrastructure as such, but are you happy with what you heard for the social infrastructure of our country after the finance minister's book?
I think a lot need to be done in that, and as well as social infrastructure is concerned, first of all, if we focus on health infrastructure, so public health facilities that really need to be improved, particularly at sub-center and PHC level. So I was expecting more from the side of finance minister. Actually, this budget came in very difficult geopolitical and even global economic conditions. So I was expecting that even more disposable income should be given in the hands of the consumer, and that I think is missing part. And then I was also expecting, if from health point of view, the extension of our PMJY. So the US, this is the first step of India toward the USC, and extension was very much required to make healthcare more affordable. And then I was also expecting a decrease in import duty on medical equipment, so which is also need of the healthcare sector. And though government tried to bring down the prices of batteries and more boost to EV vehicles, but still I think there should be a direct provision for tackling pollution in the country, which has a direct impact on the health. So that part again is missing, and obviously the human resource scarcity in the health sector that need to be addressed. Though for elderly care, 1.5 lakh health professionals will be trained, but I think a lot need to be done in that. So this is one part we need to create social infrastructure. I think that is missing in that part. And then attracting foreign direct investment and foreign portfolio investment again, which is very important. I was expecting that even some relief on short-term, long-term capital gain. And this is the reason you said market is not accepting this budget. This is the one reason. So apart from social infrastructure, these are also few things I was expecting in the budget. In very difficult global geopolitical and economic conditions.